Hi everyone, welcome to Raahee's stream of Mann Ki Baat, Raahee ke Saath. We have three panelists here with us, Dr. Mayank, Miss
Very good
Aaushi,
evening.
Shreya.
Hello.
Okay, so we'll let
Hi.
everyone give their introductions. Over to you, Mayank.
Okay, myself, Dr. Mayank. I am a psychiatrist and I am working as a senior resident in Maharaja Agha Singh Medical College near Hisar. Thank you. Over to you.
Shubhangi, you're on mute.
Sorry,
Yeah.
Aaushi, would you like to go next?
Yeah. So, hi everyone. My name is Aaushi, and I'm actually a psychologist, consultant at Raahee Foundation, and yeah, I've been practicing as a counseling psychologist with them.
Shreya.
Okay, hi, I'm a psychotherapist and I work as a private practitioner and I've joined Rahi as an external therapist and I've been working for the last 3 years. So yeah.
Wow, that's great. And we have this amazing panel here. So if you have any questions related to therapy, feel free to drop them in the chat. And I think we have 14 people here. So you can also drop where you're joining from. And I'll introduce Rahi for a minute and who am I as well. So I'm Shubhangi. I'm one of the co-founders of Rahi. And Rahi is an initiative to destigmatize mental health and also provide affordable therapy. So we have these amazing therapists from Rahi as well here to guide us, and Dr. Mann joining us as well. So, this is a very common question that we at Rahi and all our team handling the clients get asked. And I think आप लोगों ने भी सोचा ही होगा कभी कि what are different kinds of mental health professionals that are there and what's the difference between you all. I mean, you introduce yourself with different terms, psychotherapist, psychiatrist. So, if you can all go one by one and tell what exactly is a psychiatrist, what is a psychotherapist, and what's the difference. Mayank, would you like to go first?
Okay, thank you. But I believe psychotherapist is anyone who does a psychotherapy. And the difference between a psychologist, psychiatrist is in the course they do, in the interventions they do. For psychiatrist, you have to do a postgraduate degree in psychiatry, MD in psychiatry or DNB in psychiatry. And for psychologist, what I know is you have to do a PhD in clinical psychology or MPhil in clinical psychology with 2 years of, I think, training in a clinical institute. I think more my colleagues will tell. And we deal with the medications part, the the pharmacy part, how to deal with drugs and their dosage, plus the therapy part. And in the psychology part, they deal with the therapy part. Now over to my colleagues.
Shreya, would you like to go next?
To expand a little bit on what Dr. Mayank said, basically the difference, of course, lies in the education field that you give. So psychiatrists have to study MBBS followed by a specialization in psychiatry. As psychologists, we study psychology. A minimum requirement for a counselor in India, I'm talking about, is a master's degree in clinical or counseling psychology. That makes you a psychologist, a licensed therapist to work. Then there is further specialization in terms of MPhil and then PhD. PhD is essentially a research degree. In India, the highest degree for a therapist is an MPhil degree. The reason why I called myself a psychotherapist is because I have an MPhil degree with a specialization in a particular form of therapy, and I have a diploma in that. So I am a specialized therapist, hence I call myself a psychotherapist because I specialize in a particular form of therapy. Ayushi perhaps can then explain the difference in perhaps her education background and yeah.
Yeah. So, like she mentioned about the clinical psychology aspect and the psychiatry, I'll explain the education background for the counseling psychologist or just a psychologist. People have done masters in clinical psychology as well. They are also called psychologists. Okay, so they do the masters in one of the particular area. Okay, and they do get additional training, so they also train themselves in some therapy, some particular approaches, so they do diploma or they do some extensive training in particular therapy. So they are also called psychotherapists apart from being a psychologist. And that's the difference between the psychiatry psychologist and the clinical psychologist.
Okay,
Okay.
that's pretty interesting. And Ayushi, I think I also know you practice art therapy. So, just a follow-up question to this, like how is that different, or what changes?
Yeah, so okay, so in India there is art expressive therapy course which is happening for like there's a diploma happening. Okay, so definitely that enhances your skills about the art therapy. So a lot of clients are not expressive verbally, and it works with them fabulous art therapy because there's a way they can explore themselves. There's a way they can actually communicate and build rapport with the therapist. Okay, it's a platform where they can just explore themselves. So that's how the art therapy comes in. Art is also known as the expressive therapy because that's the way they express themselves. It works great with kids and young adults basically. So they are not able to verbalize their concerns and everything. So yeah, so that is something I have not additional trained yet, but that is something people get trained in that. Like they have a proper diploma for 2 years and 1 year, depending on the institute. So there are many institutes in India which people can look up for art expressive therapy.
That's great. So we are talking a lot about therapy, and this is again one of the most common questions we get asked, like when do you know that you need therapy? So, Shreya, would you like to go first on this one?
Yeah. So, lots and lots of different reasons why people come into therapy. One of the most common reasons why people would come into therapy is that when certain emotions, certain difficulties start to interfere with your day to day living, that I'm feeling anxiety and because of which I'm not able to work to my potential. That's one primary reason why people would come. Other than that, that's not the only reason why people can come for therapy. If you want to explore, if you want to just share, if you have, you want to build more self awareness, all of those reasons someone can come for therapy.
That's great. Yeah. Mayank, Ayushi, any of you have anything to add?
Okay. Um, Let me explain. Why do we need therapy? As Shreya said, when you have difficulty in your daily functioning, you start avoiding some situations, you're not able to deal with your daily life stressors, or you're not able to cope with the things, or your way of living, or maybe some issues which are not as per the society. So you try to fix them, or you try to seek help for them, then you need a therapy. Then that's how you know that you need a therapy. Or it can be on other ways. You always, it's not like you know that you need a therapy. Someone can also tell you that maybe you must seek help, or seek uh, you can seek some psychologist or psychiatrist for these things. That's how you know why when you need therapy.
That's a great answer.
Uh,
So
I, I would I would like to add 2 points here. So what Shreya and Dr. Mayank have added, people also seek help for relationships. Okay, not only relationship with others but also relationship with themselves. Okay, sometimes. So there are like Shreya mentioned, there are so many reasons that we cannot put it in labels right now. Okay, okay, you need therapy only for this, not in this. Uh, there are many reasons. We cannot just be, even if we say the list, we might miss some of the points. But one of the important aspect I could recall right now was the relationships also, and also getting adjusted to the environment. Sometimes adjustmental concerns also people are facing. Okay, so that affects the daily function in simple way. Or sometimes people just feel they feel some emptiness within themselves. Okay, they are just saying that everything is going perfect in life, but they just feel missing out somewhere. So these are also a couple of reasons that people sometimes seek help. So yeah.
yeah, I think I would agree to that. I mean, I was talking to someone who was like, I'm done with life. I don't know what else to do. I mean, they are in 20s. So like, I think you should take and try therapy. That could help you. Um, so the next question I have is, whom do you approach first? So in my head, it's like, approach a therapist, which is like a counseling psychologist. If it's severe, then a clinical. And if you need medication, then a psychiatrist. But am I right? um, Mank, if you'd like to go first here.
I would I would say that you would approach a mental health professional. It can be anyone. It can be a psychiatrist. It can be a psychologist. It can be a social worker. It can be a mental health nurse. It can be a primary care physician who can refer you to specialists. So it can be, or there are other, apart from the mental health professional, you can approach your guardian. If you are in school, you can approach your teacher. If you are in university, you can approach your principal or the figure with dealing with the things there.
That's a really great response. I never thought that we could do that. So yeah, thank you for that. And the next question that I have is, so a lot of people just like you also said, they take therapy for a reason. What if they don't have someone to talk to? Like they just want to have someone who listens to them, because in our life we have people, we have friends, we have family, but sometimes they don't share beyond a point. Like we can't talk to them beyond a point. So is that something we can take therapy for or approach you for? Ayushi, if you'd like to go.
Okay, so definitely when a client comes to in the therapy room, there is certain level of vent out. Okay, if that's the correct word of vent out, when they are just telling they don't have anybody to listen to, but therapy has certain goals. Okay, so if there are no goals, the therapy doesn't work, and there is nothing. The client is benefit, like they are being heard, they are given a safe space, they are getting the that trust that someone is here who is just going to not share anything to anyone else, because there's a confidentiality, there are certain ethics which we follow. But just a client cannot just come for the therapy only just to release the emotion. Also there should be something that healing should happen. Okay, so yeah, so one way if we see, yes, went out is a part of therapy, but it's not the only reason people come for therapy. Okay,
Yeah.
if the client only is looking for that aspect, that they just want somebody to just listen to them or hear them, and maybe give a safe space where they can actually talk about themselves and they are being heard, though then we do have support groups. If we say, in I know that in India the support group is not that ethically being used, or some people are not even aware that it exists. So a lot of awareness in that area is required, but at the same time more support groups which are actually working, that needs to be improvised with the ethics and everything, that also needs to be done. But yeah, this is the difference where I would say that cannot be the only reason for the therapy, but that can be one of the reason for the therapy. Yeah.
Shreya, would you like to add anything?
I think just building on what she said, what she's trying to say is that when someone comes into the space and is even venting out, there is a lot of exploration of different emotions that are coming out that can then happen in the process. So, venting out can be the first stepping stone towards taking that help that you need, and then the therapist will help guide you how to manage that or how to take it forward. It just doesn't stop there. It can potentially, but there is a step more to it than just a blank face listening to you. Yeah. And very correctly and very aptly, I think she mentioned there are a lot of support groups also where you can kind of vent out. And then again, the point of them is also to learn, to grow. So, yeah.
Okay, thank you. And so Ayushi also mentioned trust, and Manya has this question in the chat. How do you know you can trust the therapist? Because a lot of times I've heard this, that there was a therapist in the organization and they reported to the manager. So what's this confusion like? What's happening here? Um,
Okay, Shreya, you
Ayushi,
want to answer, or
And
okay?
I
Okay.
think how you can trust them with confidentiality. Is that the question, or how you can trust them generally is the question?
like with confidentiality, like in organizations or in general, like just know that you won't call someone up and say, "Okay, this is all
Uh,
happened with this person."
yeah. So, well, it's just like doctors are bound by this what is, sorry,
HIPAA.
hypo, huh?
HIPAA.
Hypocritical.
Hypocritical
Okay,
oath that they
hypocritical.
won't. Yes, no, HIPAA is in the US. Yeah, so
Oh,
hypocritical oath that they won't. There is an unsaid rule that does come, and ethical work means that we are not going to go beyond confidentiality. That also means that there is an informed consent that we make all the clients sign, which does state that we will not breach our confidentiality unless there is a risk to your health. Unethical practices are there which can break your trust, and we hope that you don't get to experience that. That is why licensing becomes very important, and uh, the mechanism to report becomes very important. And I'm glad that you have that in place so that someone can report that this is what happened, and that can be taken into consideration.
Okay. Aish, do you have anything to add? Because you both smiled.
Yes. I agree with what Shreya said. And also to add on what, like people, so if you're going for the therapy for the first time, okay, you can have certain red flags you can observe. So for example, if you can check the background check of your therapist. Okay. Nowadays, therapists are online somewhere, they have some listing, some profession, or even if you're having first encounter with your therapist through email or through phone or something, you can ask them to about their qualification. Yes, a therapist, a client has the right to ask the qualification of the therapist. That's the right they have. They can ask, give me what qualifications you have, where you have worked before, years of experience you have. They have complete right to know this. So they can ask these questions explicitly to the therapist. Secondly, the that encounter will give you that confidence whether you can trust this therapist or not. And secondly, when you go in therapy, you can see when you're talking about certain things, do you feel safe, because therapists also create that safe environment. So confidentiality part, how are this therapists explaining the confidentiality part to the client, that can also make an impact on the client. Okay, this person is telling me what is actually the rules. They are not creating that something more anxiety or giving some other things, or not even mention about confidentiality in the first session or something like that, and never mentioned about it. So that's, or you can, or as a client, you can explicitly ask that, are you going to talk about my case to anyone, your supervisor, your manager? Yes, clients can ask those questions to the therapist. So this is how you will know whether you can trust or not. And like Shreya mentioned, yes, there is a lot of unethical practice, and that is something we can try to avoid by being more mindful about what therapy looks like beforehand. But yeah, that is something we hope we don't experience it, but yeah, that is happening around us. Yeah.
Thank you both, Shreya
I,
and Aishi. So, yeah, man, go ahead.
I would like to add one point to this. And as per the new Mental Health Care Act 2017, we are legally bound. There is a right to
Yeah.
confidentiality for the patient.
Okay. That's pretty great then. Now we have like a legal amendment to this. So Mayank, I have this question for you because I mean, to be honest, I have not spoken to a psychiatrist before. So, like, can you also do the talk therapy, or is it just for medications? Like, so if you can elaborate a little on that.
See, we prescribe medications and we do the therapy part. Because
Okay.
when we are dealing with the patient, it's not just like that we will just give medications and will not do the intervention. Because the intervention is for the for the medical condition, not that who is doing it and what to do.
Got it. That's great. And a lot of people like kind of are scared of psychiatric medication, so they don't, approach when even if they are redirected towards it. So, can you like share what exactly you prescribe and how things work? Like, it's not कि कोई आएगा तो आप medicine दे ही दोगे, right?
No,
you.
no, no. I'll add two, 3 points. First of all, there are proper guidelines for the management, which
Yeah.
the guidelines include the pharmacotherapy part plus the psychotherapy part. So it's not like keep patient eye and we will just prescribe medications.
Yeah.
Okay. Second thing is there is a lot of stigma around the psychiatric medications that कि हमें नहीं लेनी है. बहुत सारे patients आके बोलते हैं नहीं, we will not take medications. But they need to understand, like, I will give you an example. Suppose someone has hypertension, he or she will take medication for that. But someone has a mental illness, he will ask. That is what I'm trying to explain. The stigma around the mental illness, and that's what we are trying to overcome with these things like these panel discussion. That they need to be they need to be, matlab, we have
Normalized.
to, they need to be normalized, and we have to seek help.
Yeah.
And that's what our government and the various organizations are doing nowadays.
Yeah. Thank you for that answer. Shreya, I also have a question for you. So there are these diagnostic tests that happen. So a lot of people don't know what they are or when to take them. So can you elaborate on that?
So, if I got your question correctly, is what you're asking me, there are diagnostic tests, and
Yeah.
when does one need them, right?
Yeah. Yeah.
So a diagnostic test in India is done either by a psychiatrist or is done by a licensed clinical psychologist, an RCI recognized clinical psychologist. That generally comes in a clinical space from the reference of a psychiatrist who needs it for better understanding the diagnosis if there is a confusion regarding that. There are some brief tests that psychiatrists do while they're, taking an like interview call with the client in the first session, and they do it then and there for further understanding. Uh, Very rarely will it happen that the client themselves would want to go in for a self test. If they've diagnosed themselves, then they perhaps may go wanting to know their diagnosis. In that case, supposing I go to a therapist and I say, I think I have depression and I would like to be tested for that. In that case, it will be upon the judgment of the psychiatrist and the clinical psychologist. If they feel it's relevant and there is enough backing to what they are saying, they will go ahead and then do the test. Just for the sake of it and just for fun, generally these tests are not done. They are sometimes expensive, and you can't just label someone, oh, you have depression, just like you can't say someone, oh, you just have cancer. You can't, right? So
Yeah.
it comes from the expertise, and they'll recommend whether you need the test or not.
Noted. Again, I think Mansi has this question. Can my therapist recommend diagnosis?
Can my
So
do
right
I
now you
answer?
mentioned, yeah, go ahead.
Huh. Can my therapist help? Definitely, they can. It's a choice. I mean, giving a diagnosis has both its pros and cons, and it depends on the orientation that the therapist also follows. Irrespective of that, it's the concerns that the client is coming in that we are working with. It doesn't matter whether you have, like, if I label that as depression or not, you're coming in with low mood, so I'm going to work on uplifting your low mood. And the same thing the psychiatrist is doing by giving you medication, we are doing by providing you different kind of interventions that we can. Sometimes diagnoses help a client understand themselves, but if that becomes an excuse to not do things, that has a pitfall. So, and the stigma attached to it sometimes can become worse, but sometimes it helps you then understand, oh, this is what I'm going through, this is how I can help myself.
Yeah,
So that kind of understanding needs to also be built. So yeah, if
I see.
anybody else would like to answer or add anything.
No. Mayank, would you like to add anything?
I would like to add, you can you just repeat the question what has been asked by that,
Just
the
details about diagnosis and when you need them.
okay. So coming to the diagnosis, see, you can always ask ki what is my, for what things I am being treated for what mental condition I am getting a therapy. You can ask for that. You can legally ask for that. You can legally ask for records of the sessions. You can legally ask for medical records also. Thus, we, to prevent the stigma, what sometimes what we do is we just writing a diagnosis will not going to help. So sometimes for that part we just skip it, or but you can ask for that, and we are legally bound to provide it. Plus we use a coding system
Yeah.
so that the mental health professional, maybe the client wants to seek any other person, so he can, the other mental health professional can see for what condition he or she is being treated for, just to prevent
So
stigma.
yeah, I
I'd like
like
to add something to what Dr. Mayank also said. He said that that the client can we can give diagnosis. It's very important to give psychoeducation about the diagnosis. If we just randomly throw words, that becomes very difficult. So if you're educating the client what it means to have that, that's, I think, a better way of giving the diagnosis. Just saying, oh, you have depression.
Hmm.
Yeah.
So I think
And
that
there
becomes
are
very.
and
I
there
mean,
are definitive criteria for that. You just can't say
Yeah.
anybody.
I think even we at Raahee feel like when one of our counseling psychologists recommend that this patient should go to another for diagnosis or clinical, we kind of take it very slow that it's okay, it's nothing to be scared of, it's not, we're not pushing you away, it's okay. They'll help you better is why we are recommending you to someone who is more experience to take your case up. So yeah, it's also difficult for us to send them to another therapist because they have this relation with the first one. So yeah.
To
Okay.
add to Shubhangi, to add to what you have said, so firstly, sometimes a client comes to the therapist, okay, okay, so therapist believes, so like you mentioned that it happened, like the therapist just mentioned that client needs to go to a clinical psychologist or the psychiatrist for the diagnosing and the further intervention, which this person is not right now equipped enough, like can help with. So when we do this, there's also like not only that, but also the therapist who is having a bond with the client, they also educate them why are we doing this, because it is important. First of all, they have taken a lot of courage to just take the first step of seeing us some taking some professional help. So it is also the responsibility not only on psychiatrists or the clinical psychologists, but also on other mental health professional or the mental health advocates, like who are just explaining, educating that why are we doing this, why, how it will help you, and we are not just leaving you, we are supporting you and giving you better health. So that you correctly mentioned, it has to be slow, but at the same time it has to also be like explaining the importance of it, educating correctly, because nowadays people just google it, why do they go, why do you need to see a psychiatrist, why do you need to see a psychotherapist. I'm not against the google, but google gives a generalized answer, they don't give the specific answer which a therapist or a particular person can give you
Yeah.
at that time, okay, why it is happening. So that can also help the people to take the diagnosis in a better way or explain them the importance of it. So yeah.
I would definitely agree. I don't think Googling diseases is a good thing. I just Googled common cold and I did not get good answers. So please don't Google your diseases. Also,
Yes.
there are a lot of online tests available. So just on the same topic as diagnosis. So I think Mana has this question like, do you take self-diagnosis seriously? Like, are these tests legit, or does the source matter, or should you even take them? Anyone? I think Shreya, you really want to answer this question.
So, when anybody asks this question, should I do this? Should I not do this? I'm generally like, like there are no shoulds in life, yeah. So you can definitely go ahead, take them. If you take them with a pinch of salt, well, great. If you feel you're relating to them or they're giving you, firstly, source does matter to answer that. Yes, there are proper like license tests that you use for specific disorders. So one random survey is not going to determine whether you have any particular disorder or not, or difficulty or not, rather. And once you take them, and if you feel you're relating to it, the next best thing to do is go consult a mental health professional and then understand from them what it means, rather than just believing that, because there is an expert sitting who can help you understand what it means to have that. So yeah, there's nothing right or wrong about taking it.
Yeah,
Just get enough understanding of it, what it means, and then yeah.
got it. Okay, I'll move on to the next question. So I have this question for Ayushi. Um, so how many sessions should one take to know that okay, now it's okay? I mean, yeah, if you would like to answer this question.
So, like in therapy, so we have long term and short term therapy. Okay, that a lot of people have heard this term. So it means basically depends on the concern and the person as well, like what they are looking for, what are their goals, what they want to achieve, or what outcome they want out of this therapy. Depending on that, the number of sessions are dependent. Sometimes what we decide, okay, this many sessions will help you, sometimes it goes beyond, and sometimes before that we terminate. Okay, so it's there's no one answer to this question, like okay, in 10 sessions therapy is done and we can terminate. That is something we can't promise, because sometimes we are dealing with humans, so definitely sometimes you do get some other issues or something else, or you just deviate from the actual goal because that something else is more important. Okay, so depending on that, so on, like it depends again also, this is one of the point. The second point here is also it depends on the approach which the therapist is using. Okay, so if they are using more structured approach, they require less number of sessions, depends, so it requires like 8 to 12 sessions depending on the goals. Okay, if they are using more psychoanalytic approach or humanistic approach, okay, then in that the client might require more sessions, again the number is not defined here.
Yeah.
Okay, so it depends on the approach as well. So yeah, so there's no definite number to this. Shreya, would you like to add something here?
I think I kind of agree with you. There is no definite number, and it does depend on the kind of therapy or the kind of approach the therapist also uses. There is brief counseling, which requires sometimes 5 to 6, then there is longer. Some form of therapies have structured 12 sessions, 32 sessions. Some are more flexible. So I think it's a judgment call that as you and your therapist together can take and decide how you want your therapy to look like.
So we have this really interesting question in the chat. Like, it's really long, so I'll read it. You like, what's a day in your life looks like? Because it's a very different, I would say, job than most people. You have like emotional terms of clients. Does it get overwhelming? How is it for you? I think all of you can answer one by one. Mayank, would you like to go first?
Okay. So, see, I would start like you have seen pediatricians. They tend to be more jolly because they always deal with the young child, infants. Okay. So that's, I think, where this question arises from, the emotional dump of the patients. See, there are two things: transference and counter transference. It can happen, but uh, we have to deal with it. We have to see that it doesn't develop during a session, during a treatment of the patient. That the conditions of the patient not affect our mental health, and our issues does not affect the patient in his management.
Thank you for that. Ayushi, would you like to go next?
So, to what Dr. Mayank said, yes, that happens. So, what we as a therapist and mental health professional do, we do have certain self care tips which we develop for ourselves, like to unwind ourselves from our work. Okay. You so that is like they have a lot of things. So they have peer circles. Sometimes they talk to their seniors or their colleagues. Okay, just to regulate what they are experiencing, because at the end we are also human, so we also do feel attached sometimes or get overwhelmed with some of the emotions which client is spoken in the session. So some days are heavy for us as well, so we unwind it by doing some self-care practice, self-kindness practice, gratitude building, journaling, um, or in some of the cases do yes, therapists do seek professional help, they also have their own therapist, so they also go there and take help if required. Okay, and also yeah, a lot of other things like they just, so sometimes as a therapist we are also aware the red flags, okay, this is something I'm experiencing, I need to take a step back. Okay, so that's how we start working on ourselves, because yes, we do have some days heavy. So yeah.
Thank you for that. Shreya, would you like to add?
Yeah. So I think I agree with what both of them said. Definitely that there are times when we have our. So firstly, I'll say that we are trained to do this. So it's come with practice. It's not that suddenly one day we're sitting and then we can start to hear and not get overwhelmed. That has come with years of practice. So psychiatry is 7 years of practice. Yeah. I have 7 years of practice. Ayushi, I'm sure, has at least 5 years. Yeah. All of us have
Yes.
that much of education
Yes.
background to then come and then sit and behold. Again, I think Mayank used two words: transference and counter transference. That is, In very simple words, I'm not going into technicalities, is sometimes when we start to feel overwhelmed by the emotions that the client is bringing in. And like Ayushi said, we need to understand those ourselves. For that, we have checks, peer supervision, our own therapists. And I think those checks help us recognize those, manage those, along with engaging in those self care tips that she's talking about. So sometimes we also have to listen to the advice that we give to our own clients. Take care of yourself before you can take care of others. And if we don't do that, we will find ourselves becoming very overwhelmed.
Yeah,
And I
that's
would like to add one thing.
yeah.
Mental illness is an illness and it can happen to anyone. It's not specific that psychiatrist or psychologist will not cannot suffer from that. It can happen to anyone.
Yes.
Yeah. So I follow this mental health page, and she's a very, I would say very choppy therapist, and I love her page. So she also posted that after one session, she sometimes binges, eats, and does what people also do. Like, don't judge her for being a human. So yeah, I really like that part. That yeah, everyone's human here. Okay, so my next question is, psychiatry is treated very differently from I mean the general branches of I would say mental health. So why is it so like ऐसा क्या हो गया कि it's so different?
So I think I would start it because it it, it is the stigma which we are seeing it that asking questions how it is treated differently. That's
Actually,
why mental illness is treated differently from a physical illness, and that's where I would give you an example. If we go 3-4 decades back, um, I think you all have heard about syphilis, a common sexually transmitted disease. Most of the asylums were filled with the tertiary syphilis patients in the Europe, in the America, everywhere in the world, and because that condition was not treatable. Then things have changed. Researches and new medical knowledge and all have developed, and now it's a very common illness. It can be treated just like that. So things are like this. Now the patients which were there in the 1950s in the mental asylums are not there right like that. So it's the stigma which we have created in our minds in the society that it is a different thing. Although if we think it as just as a mental illness and we have to treat it, then I think we are doing far much better things to the society.
that's a great answer, man.
I'd
Yes,
like to
sir.
share a little story. So, I was just joining my masters, and in my masters interview, when I was interviewing at a college, so the professor sitting there asked me, what is the difference between, like, why is there a distinction between mental health and physical health? And my answer was, and you can laugh all you want, I don't know, but the everybody says mental health is different and physical health is different, and all the courses are different, so it must be different. I said that, and obviously, I did not get admission at that point in the college because, yes, why would I? Then I thought about it. Like today, when I'm sitting here and I reflect upon that, I said, how did, like, I was never even told that mental and physical health is the same thing. It's a part of me. How can my head function differently from my body or my body function differently from my head? But for some reason, I don't know why I thought they were two different things. And that's how it should be because it's written on paper like that.
I can understand that. Yeah.
Hmm.
Okay. I should have anything to add?
So I actually resonate with Shreya because not that question I was ever faced, but when when okay, if I have to tell my journey, I was never aware that what psychology is. Okay, because no one has ever told me in school, or there was no mental health any understanding, any awareness, like what it is. Like I was not aware. I was like, oh, it's interesting. That's how we started. And then more you get into it, the more you understand, okay, this is what it is. How this is how your mental health, physical health affects you. first you, and I wouldn't say that we are giving the space to everyone, where we give the safe space to people, we give non-judgmenting this thing in the therapy room and everything. We have learned that, we are trained in that, because the more we read, the more we talk to people, the more we get reflections on ourselves, the more peer supervisions and supervisors updating and polishing our skills. That's how we trained ourselves, and that's how we realize, okay, now we are able to understand that how the society is treating them, or how the society is treating everyone when we are talking about mental health. Because like today also, if we talk about, like, okay, I'm a mental health professional, if I see this in front of people, I do get some weird looking eyes. At the same time, I can see curious eyes also, and they have a curious questions which are like very stigmatizing, but I'm very happy to answer to those questions, because at least I feel, okay, there is one step, at least they're asking me that those questions, they're not creating their own stories. But yeah, that is something have progressed in last 5 years, that people have at least started questioning. Rather, before, people were not even questioning, they were just giving this looks, okay, she or he, they are from a mental health background, they work with these people, they are this, they are that. We do get the stigmatized thing, but I think now people have started questioning. So there's a sense of curiosity in the society, where people want to know, want to educate themselves, like what exactly it is, how do you work. And I think the question which was asked earlier, that how do therapists deal with it, their emotions and everything, so that is very insightful question, that people are asking this question. So yeah, because no one ever asked these questions to us.
Yeah.
So that is something I would say, that's how we have progressed. But yeah, we do have to achieve a lot in breaking the stigma. But yeah, this is something we all have experienced in some or the, and we have many stories like that. But yeah, we do experience such things.
Yeah, I can understand. I think we had this one intern at Raahee who was doing bachelor's in psychology, and she said that her parents, when she started, said that, "Why are you becoming a safe?" I'm just quoting her, "Ki paglo ka doctor," and then she tried to explain that it's not that. Like, it's not what you think. It's pretty novel. So, yeah, I think after COVID, I think we have more light on this topic, and it's okay to have mental health problems, and it's not anymore the thing people call. So yeah, thanks to COVID for something. Okay, so my next question is, this is for Mayank, I guess. So general physicians also prescribe antidepressants to their clients sometimes because maybe it's needed. So can they do that, or should it come from a psychiatrist only?
I'll say that they can prescribe if they have the skills to do that, if they have knowledge and if they know the proper treatment plan for the patient, they can prescribe. The first thing for any illness, not mental illness, for any illness is do not harm the patient. If you don't know it, if you don't know how to treat it, do no harm to the patient. So if they have the knowledge, they have the training, they have the expertise, they can prescribe. And in India, a lot of patients are not being treated by qualified professionals. They are being treated by unqualified people also. So it's not like you are you can prescribe it to now. You need if you how to treat it, you can. But the thing is, do no harm to the patient. If you don't know it, just refer to a better treating person.
That's definitely true. So I also have this question. Sometimes we start our therapy and maybe we take 2-3 sessions or more, and it doesn't work for us. Like, we just realize it's not working, or whatever parameters we set in initially are not being met. So how to deal with that? Like, do you stop, like, kind of stop seeing the therapist? Do you tell them that this is what is happening? Like, what's the solution here? Shreya, would you like to go first?
So, ideally speaking, it's very, very important that you do discuss this with your therapist, but often it becomes very anxiety provoking to actually ask this question to your therapist and go ahead and have it. So, most of the time, what we'll notice is the person drops out. However, I would encourage clients to share this. And in this process, it's helpful if the therapist can give that little bit of what we call scaffold, like a backing to it, where they can tell their client, especially in the first session, that, if you are not feeling comfortable, if there's something on your mind, I'm here to hear you and answer those questions for you, which can help them give that, help their ease in their anxiety to be able to ask that questions. Because directly confronting, if it was that easy, well, we would all be doing it, right? And so it becomes important. It's like a two-way street. I think building that confidentiality, I think Aaushi had also mentioned at one point, where the therapist also needs to talk about their own confidentiality, talk about how I'm open to feedback and I would like to make this space as comfortable for you. And if you're feeling otherwise, discuss that with me. Or a lot of times I tell my clients in the first session is that discontinuing is your choice. However, I would encourage you to discuss that with me once, and when you do, in that, all the difficulties that you're facing, you can discuss. And if you feel that you're not able to handle it and the client wants another referral, then you can both decide what you'd like to do after that.
That's good. Any of you, would you like to add anything?
I would like to add, see, every individual is different and response to any condition varies from person to person. So it's not like anyone can assure that I'll treat you and you will be 100% fine. Everyone tries, every doctor, every therapist, every psychiatrist, psychologist tries his or her best for the client. So the response varies, and there are factors like on the part of the patient, that whether the patient or the client is complying to the advice given. So that is also important for the response. Plus, we if like after 2 or 3 sessions there is a dropout, so we can give the patient choices about the available treatment options. It's perfectly his choice to decide whether he wants to continue or not.
That's definitely true. I should have anything to add.
So I agree with Shreya and Dr. Mayank on this thing that uh, people they have right to actually discontinue, but before they discontinue, definitely they can share this with the therapist itself, because this will give them also the closure. Because what happens is, if they drop out from one therapist, they are very reluctant to seek another help or
Yeah.
look out for another therapist. uh,
Yes.
so that is also the one of the concern which we face. So once you speak to the old therapist, yeah, your wish, you can discontinue, you can ask for referrals and all, but there will be one closure in this relationship. So it's okay to drop out, okay, and it's okay to discuss and share it with your therapist. Also, it is on therapist as a responsibility that you create that space that your client feels comfortable, or at least they have that they can at least speak about the concerns which they face. Okay, they are not comfortable with your approach, or they are not comfortable with what you do, or they are not sure whether this is helping them, to get some clarity. That space a therapist provides in first initial sessions, because that's how the rapport is built. Once the rapport is built, it's easier to speak. But before that, like if you're talking about like third and fourth session, the rapport is just establishing, it has not built. So definitely the client will feel that anxiety. Okay, how can I say this, this is like confronting, they might feel bad, and what, and so many thoughts. Okay, so definitely I would encourage to people, please speak to your therapist. Okay, they they can help you with the closure, at least with one relationship, so that you can go, if your plan, if this is not working, you can seek another help, and they can give you the referrals. But that shouldn't backfire, that they just go into the shell of not taking help in future because of this. So that is something very negative impact of dropping out.
Yeah, true. I would say that even I took like I don't know, 6 months to find a therapist. I did art therapy, but the therapist had to go for her higher education, and then I took like 6 months to find a therapist, and I then stopped it because I mean, I better like art therapy, so it wasn't working. But then I started attending support groups. So this is like a more personal question, and also someone in the audience asked. So, can support groups be a substitute for professional help, as in therapy? If you would, Ayushi, would you like to answer?
Okay, support group cannot be a substitute for professional help. I would say it's a clear no. That's my perspective right now. The reason being that support group is for the it gives a space for the people to speak and normalize what they're feeling, and others are listening to them. It's a circle which just emotionally support each other. But on a daily basis, if your functionality is getting affected and you're not able to function well, you have a lot of thought, like you have to work on certain things, particularly the professional help is needed. Support group has its own agendas, like it depends on the support group you have signed up, they have their own agendas. If that could be holistically achieved in that, that's fine, but after a point sometimes it is not beneficial because you need that individual attention and professional help expertise in certain areas. So for that you need the professional help. Okay, I think Shreya can help you. I think you can answer this in a better way. But yeah, for this was my understanding with this.
So I think when we talk about support groups, it's very helpful to understand what do you mean by support group. Is it support group? Is it group therapy? And who is the group led by? So if it's a professionally led group, and if you're talking about that support group or group therapy, often confused words, not going into the technicalities to explain that right now. If it's being facilitated by a trained therapist, it's a different form. So therapy has different form, group therapy or individual therapy.
Yes.
Neither is right, neither is wrong. Both are researched mental health interventions, and both you will benefit from. Sometimes the goals can be different in a group therapy space. When you're coming, they can be different in an individual space. Again, speaking ideally, be a part of both, you will benefit the maximum. Yeah, you can choose to be a part of one, and you can choose to be a part of two, both of them as well. Then there is support groups which is led by peer supervision. Perhaps that's the kind of thing that Aaushi was also talking about. And they are helpful definitely as peer supervision, but they may not have that professional help that you may need, and it would be helpful to be a part of that as well. So yeah.
God, that's a pretty great answer. Even I got some insights from that. So I think we'll take some audience questions because they have a lot of questions. So there was this question from someone like Deepa: how to deal with painful memories? Is like anyone would like to take that up?
Okay, I can.
So,
Okay, go ahead, man.
Shivangi, you only choose.
Ha.
how to deal with painful memories? See, we have to see that what symptoms we are experiencing, whether just it's just a cognitive thing or just we are having physical symptoms associated with it. If you are having just a cognitive thing, you can seek help from a from psychotherapist. Okay, and if you are having physical symptoms along with it, then you can seek help from a psychiatrist.
So I have seen this as well. Like a lot of people kind of live in the past. Like especially since COVID, they're like, my life was good. मैं बाहर जाता घूमता था ऐसे बहुत लोग करते हैं. So do you think they should take therapy? Like, are they also living in memories in a way? Like, or is it okay? I mean, I don't know if it's just a follow up question to living in painful memories and good memories as well. So a lot of people live in good memories also, not just painful ones.
Okay. To answer that, living in memories is not a problem at all. It's absolutely fine to live in any memories. You want to live in good memories, bad memories. Bad memories can help you remind of times when you've made mistakes or done something that you don't want to repeat. Good memories can be a reminder like, oh, this is what I want to do again. So let me plan something. Sometimes the difficulty arises when we aren't able to step out of them and, like you said, come to the present moment.
Yeah.
What are the painful memories stemming from is the main question I would ask. Are they stemming from past traumatic incidents that you've had? What are the experiences that you're being reminded of? And along with what Dr. Mayank said, overall to look at what other concerns are you facing along with it? And then to address those. There are specific ways. Sometimes on very extreme times, people experience flashbacks, people experience nightmares. They are when dissociation. Yeah, all of those are when how painful memories kind of express themselves. Or it can be I'm constantly thinking about or obsessing about one particular painful memory that has been. So then the question was how to deal with them. Unfortunately, I cannot tell you how to deal with them here, but because I'll have to understand much more about your painful memories and how it's impacting you. So when you come to therapy and do, definitely they can be dealt with. Uh, and there are specific, usually a lot of trauma informed work is then done, or understanding where it's coming from. So I'd be happy to have you in my space to work with that. But I mean, I cannot give you one answer right now because,
Yeah.
yeah.
Okay, so I think we have only 4 minutes left. So I would, you just mentioned this trauma informed, and I have seen this word going around a lot. So is there like a diploma course for this, or, um, you know, like Ayushi mentioned, for art therapy, there's a diploma. So for is this there a
So there
course?
is certification courses that happen, but it doesn't necessarily mean that you have to be. If in your education you've studied enough about how trauma informed therapy is done in India, at least so far, you don't require a specific certification as long as you know that you're being ethical and you're following. There are certain specific things that trauma informed therapy has, so you can actually use that approach,
Okay, that's great.
or you can be certified in it through international bodies.
Got it. So I think these were all the questions I had and the audience had. Do you have any closing notes? Let's go one by one. Mayank.
Anything to say to add
Yeah,
to?
any ending notes,
Okay. Okay. Thank you for such a wonderful session, and it was nice experience having as a panelist at Raahee. And I'll say to my viewers that you definitely seek help for anything you feel that it's something abnormal or you are having trouble with, be it a mental illness or any other thing. You can seek help from a mental health professional. Thank you.
Thank you, Mayank. Ayushi, do you have?
So yeah, it was wonderful that we talk about. I'm really glad with those questions that there were certain questions were really nice that people are asking. So thank you so much, the audience. That please you have asked good questions and please keep on asking on any platform, social media platform. There are therapists who have their pages or something. You can personally DM those questions sometimes or ask for clarifications. Don't rely on Google, rely on more human. That's something I would like to highlight, that trust a human being. It can be anyone. I think today we spoke that once you start a therapy, whom do you approach? You approach anyone. It can be a guidance or guardian or a guardian or a caretaker or teacher, anyone. Just talk to people to seek help, so they can give you the thing like where to go next, how, who can help you, how can they help you. Okay, so asking questions is something I would really encourage people, that please ask questions to anyone. There's nothing wrong in asking questions. Okay. Um, Secondly, thank you so much, Raahee, for creating this space and inviting us and just having this conversation. Thank you, Dr. Mayank and Shreya. It was really nice conversing with
Thank
you
you.
too today and discussing about this. So yeah, thank you.
Okay. And Shreya.
Yeah. So, firstly, thank you to Rahi for organizing this space, and secondly, to Mayank and Ayushi for being here. I think it was a lovely discussion. And I totally agree that, asking questions is beautiful. That was beautifully said, Ayushi. And I said, last thing I'll say that Mayank said that, if you have if you're concerned or you have anything, approach any mental health professional. They'll direct you to the right place. So with that, I think, yeah. I also see some questions about emotions. Again, very difficult to answer how to deal with specific emotions. But I think come to therapy and explore your emotions and you'll get your answers.
Yeah, definitely. To sum it up, all, thank you everyone for joining in. And as everyone said, please ask for help. And at Rahi, we do provide you consultation calls as well. So you don't have to go in for commit 1 hour straight away. You commit 15 minutes and then you explore if you need therapy. So we're not going to catfish you into taking therapy. So please take help, and we will only give you help if you need it. And therapy is a safe space to take. And at Rahi, we keep on doing these sessions. And as you all know, February is coming up, and a lot of you will have certain emotional issues leading related to loneliness or relationship issues. We'll be having more sessions related to that, and a space for everyone who's single to come up and chill with us. So you can follow us on our Instagram for that. And on a serious note, we are supporting the education and mental health of young girls in a school in Tughlaqabad. So I'm just dropping a fundraiser link so you can help them by supporting their mental health as well. So if you have extra cash lying around, feel free to donate and support their mental health. Um, Thank you, everyone. And thank you, Mayank, Ayushi, and Shreya for being amazing panelists and answering all the questions in the audience had. And we'll see you soon again, I hope.
Thank
Yeah.
you. Thank you so much.
Thank you.
Bye.
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 Bye.